Welcome to the deep dive. Ready to explore two medical conditions that sound so similar but have completely opposite effects on the body.
Yeah, it's pretty wild how that works, right?
Today it's all about SIADH, that's Syndrome of Inappropriate Antidiuretic Hormone, and DI, or Diabetes insipidus.
Definitely a bit of a mouthful.
We've got some fascinating medical studies and guides to help us out, so we're going to untangle these tricky conditions. By the end, you'll be up to speed on causes, symptoms, treatments, the whole 9 yards.
Sounds good.
But before we get lost in all that medical jargon, can you give us a quick refresher? What does antidiuretic hormone, ADH, actually do in the body?
Oh, ADH, it's basically your body's internal water regulator. Produced in the brain, it tells your kidneys, hey, hold on to that water.
So without it, we'd be what, like constantly dehydrated?
Pretty much, you'd be peeing nonstop and wouldn't be able to keep the right balance of fluids and electrolytes in your blood.
Okay, so ADH keeps everything running smoothly. But where do SIADH and DI fit into all of this?
Well, both conditions involve ADH, but in totally opposite ways. Think of it like a garden hose.
Okay, I'm listening.
In SIADH, it's like the nozzle is stuck closed. Too much ADH means your body is holding on to way too much water, like a super soaked sponge.
And with DI, it's the opposite, right? Like someone poked holes in the hose and you're losing water like crazy.
Exactly. Not enough ADH, so that water's constantly leaking out.
To help keep these straight, we can use those handy mnemonics, right? Soaked for SIAD and diures for di.
Exactly. Let's start with SIADH and break down soaked.
Okay, what does the S stand for?
S can remind us of some of the possible causes of SIADH. Things like small cell lung cancer, a severe brain injury, or even infections of the brain such as meningitis.
Some serious stuff there. What about the O?
The O stands for osmolality, specifically low blood osmolality. Imagine your blood is like a glass of juice. Too much water, it gets diluted, and that's kind of what happens with low blood osmolality in SIADH.
Makes sense, so the blood's diluted because the body's holding on to all that excess water. Which brings us to A, right? Adds DAH2O, meaning an excess of ADH.
Precisely. Kidneys are getting the signal to conserve water even when the body doesn't need it.
Wow. Didn't realize too much ADH could cause so much trouble. What are some key symptoms people should watch out for? The mnemonic mentions headache and confusion.
Yeah, those are important ones. Headaches, they can be an early warning sign that something's off, especially in SIADH.
Right.
And confusion, well, that could mean the brain isn't functioning as it should. Makes sense when you think about it. Too much water can actually make the brain swell.
Oh, wow. That's scary. Is that swelling related to the low sodium levels we hear about with SIADH?
Absolutely. That low sodium or hyponatremia is a major issue with SIADH. Remember how we talked about the blood being diluted? Well, too much water means the sodium concentration in the blood drops. And sodium, it's crucial for our nerves to work properly.
So if sodium gets too low,
Things can go haywire. Seizures, coma, even death in severe cases.
this is where it gets really serious then. Early detection is key. What about the E in the mnemonic?
E stands for eat salt and take diuretics. Gives us a clue about managing SIADH. Since the problem is too much water, doctors often restrict fluids and might even prescribe salt tablets to boost those sodium levels. Sometimes medications called diuretics are used to help the body get rid of the excess water.
Diuretics, like what people take for high blood pressure.
Yeah, similar concept. But it's important to remember, treatment always depends on the individual and what's causing their SIADH.
Of course, every case is different. And finally, we have D for daily weights.
Right. Tracking daily weight can help monitor how well treatment's working and alert someone to sudden changes.
So all about catching those warning signs early on. Okay, we've covered soaked for SIAD. What about DI? How does the mnemonic diures help us understand that condition?
Let's start with the D. This stands for damage to the brain. Think tumors, trauma, or even complications from brain surgery.
And those can all disrupt ADH production.
Exactly. Instead of too much ADH, with DI, we don't have enough. And that lack of ADH leads to a whole bunch of problems.
Yeah.
The I in diures stands for insipidus, which literally means tasteless. It's talking about the diluted urine in DI. Remember those holes in the garden hose? The kidneys are constantly trying to get rid of water, leading to large volumes of very dilute, tasteless urine.
And I bet that's where the U comes in.
Yeah,
Urine output is high SIADH. It's draining fluid from the body.
you got it. And because of that constant fluid loss, people with DI experience extreme thirst and dehydration. That's the last E in our mnemonic.
It sounds like DI can really do a number on the body. All that fluid loss has got to be tough to handle.
It can be, yeah, especially without proper diagnosis and treatment. Remember how we talked about the importance of sodium in SIADH? Well, in DI, we have the opposite issue, high sodium levels. Hypernatremia, it's called.
Okay.
When the body loses too much water, the sodium in the bloodstream gets more concentrated.
So it's like that glass of juice again. But this time, instead of adding too much water, we're boiling it down. So the flavor, or in this case the sodium, gets super intense.
Perfect analogy. And just like too little sodium can cause problems, too much is just as bad. We're talking severe headaches, seizures, even coma in severe cases. It's really important to keep a close eye on sodium levels in people with DI.
Makes sense. This is all starting to click now. So we've got the D, the I, the U, and the E and D re's covered. What about that R?
Ah, yes. The R reminds us to reach for desmopressin. Desmopressin is basically a synthetic form of ADH that can be prescribed to treat DI. It replaces the missing hormone and helps the kidneys hold on to water.
So like putting a patch on that leaky hose, stopping the constant water loss.
Exactly. And along with medication, it's super important for people with DI to stay hydrated, especially when it's hot out or they're exercising.
Makes sense. But with all that fluid loss, wouldn't they constantly feel thirsty anyway?
Oh, absolutely. Extreme thirst is a major sign of DI. The body's always playing catch up, trying to replenish those lost fluids.
And remember that S in diuresis, skin and mucous membranes become dry. Seems like all those dehydration symptoms really add up.
They do. And if DI isn't treated, it can cause serious complications. That's why early detection and proper management are so important. We talked about some treatments for SIADH, things like fluid restriction and diuretics. How is treatment different for DI?
Well, it seems logical that with DI, the focus would be on replacing that missing ADH and making sure people are getting enough fluids.
Yeah.
So besides the desmopressin you mentioned, are there other ways to manage DI?
Yeah. Lifestyle changes are often recommended, like avoiding caffeine and alcohol. Those can actually make dehydration worse.
Right.
And in some cases, if there's an underlying treatable condition, addressing that root cause can really help improve symptoms.
Wow, this is a lot to take in. You know, even with the mnemonics, it's easy to mix up SIADH and DI. Do you think it would help if we did a side-by-side comparison, the key differences? Sort of like a mental table for our listeners.
That's a great idea. Yeah, a clear comparison will really highlight how different these two conditions are. So let's start with ADH levels. In SIADH, we have high levels of ADH, that overactive water conservationist.
Right.
But in DI, it's the opposite, low ADH levels, which leads to all that water loss.
Okay, so high ADH and SIADH, low in DI. What about sodium levels?
Sodium levels, also a major difference. Remember, in SIADH, the blood is diluted, leading to low sodium or hyponatremia. But in DI, the blood is concentrated from the water loss, resulting in high sodium or hypernatremia.
Interesting how they're almost like mirror images of each other in a way. What about blood pressure? Any difference there?
There is. In SIADH, blood pressure tends to be high because of all the extra fluid.
Okay.
But in DI, it's often low because of dehydration.
What about urine output? I imagine that's a pretty clear distinction.
Definitely. In SIADH, urine output is low and concentrated. Those kidneys are holding on to every drop.
Right.
But in DI, high urine output and it's dilute. The kidneys are working overtime to flush out those fluids.
It sounds like the kidneys play a huge role in both. What about the key symptoms? How could someone tell the difference between SIADH and DI based on what they're experiencing?
Good question. With SIADH, remember soaked. We're looking for signs of fluid overload. Things like headache, confusion, even seizures if sodium levels get dangerously low.
Right, so SIADH, it's all about too much water, leading to those neurological symptoms. What about DI?
Think diuresis. With DI, it's dehydration we're worried about. Excessive thirst, frequent urination, dry skin and mucous membranes, and potentially those severe neurological symptoms if sodium levels get too high.
This has been incredibly helpful. I feel like I have a much better grasp on how SIADH and DI differ now.
Yeah, and it's fascinating, right? Two conditions, same hormone involved, but with such dramatically different presentations, it really shows how important that ADH balance is in our bodies.
Yeah, it really shows how finely tuned everything has to be. So we've covered a lot of ground today. The role of ADH, those tricky acronyms, SIADH and DI, even created a mental comparison table. Why does all this matter to our listener? Why should they care about these medical conditions?
You know, we often just go about our day taking our bodies for granted, until something goes wrong, that is. This deep dive shows how important it is to pay attention to those little signs that something might be off.
Right.
If you've got headaches that just won't quit, Unusual thirst or changes in how often you pee, don't ignore them. Could be your body trying to tell you something's up.
So we're not saying everyone needs to become a doctor, but having a basic understanding of your body and what to look out for, that can really help you advocate for your own health.
Absolutely. Knowledge is power, especially when it comes to your health. Never hesitate to reach out to your doctor if you have any concerns. They can help figure out if your symptoms need more attention and get you the right treatment.
This has been such a valuable deep dive. We've learned so much about ADH, unpacked those tricky acronyms, SIADH and DI, even created a mental comparison table to help keep everything straight. Any final thoughts you want to leave our listeners with?
Well, thinking about the serious consequences of untreated SIADH and DI, it really makes you realize how important early detection and proper management are. Pay attention to your body signals. Don't wait to get medical advice if you notice anything unusual, especially with your fluid balance or sodium levels.
Great advice. A huge thank you to you for taking us through this complex topic. It's been a pleasure having you on the deep dive.
My pleasure. Always happy to dive into these fascinating medical mysteries.
And to our listeners, we hope you found this deep dive as enlightening and empowering as we did. Keep exploring these conditions. Keep learning about your amazing bodies. We've included some extra resources in the show notes, so be sure to check those out. Stay curious, stay informed, and until next time, happy diving.